Hi there, I'm Morgan. I am the nurse navigator at Penn Health Cancer Center at Penn. My entire nursing career has been here at Penn Hospital. I have worked on the third floor, which is the general population if you're admitted to the hospital, as well as in the ICU. And I recently came up to the Cancer Center as the nurse navigator.
And I'm Diane Wilson, and I am the previous nurse navigator here at Penn Cancer Center. And I have been a nurse for almost 17 years. I worked in the operating room prior to coming up to the Cancer Center. I've been up here now for 4 years. After vacating the nurse navigator position, I took the RN coordinator position here.
Diane, you've been at our Cancer Center for a while. What can you tell us about Penn Health Cancer Center at Penn?
So our Cancer Center is located in the hospital, and we treat all cancer types. We also treat a lot of hematology conditions such as anemia, and we are privileged to have all of the services here in Rockingham County that the patients may need. We work with UNC Rockingham for patients that need radiation. We also send our patients to Wesley Long Cancer Center for radiation as well.
Now, I know that we live in Tobacco Town and we see a high incidence of smoking and lung cancer. Why is this concerning?
So lung cancer is among the most common cancers for both men and women, and especially here in Rockingham County and in North Carolina. Lung cancer is among the leading cause of death of all the cancers. And not everybody that smokes gets cancer, but smoking does cause 85% of our lung cancers. Smoking can also cause other diseases of the body, such as, heart disease, kidney disease, and of course it causes damage to your lungs, such as emphysema or COPD.
From what I know, the low-dose CT program sounds like a great way to catch lung cancer earlier. What else can you tell us about this program?
So a low-dose CT lung cancer screening program is a way to identify lung cancer early. Early detection can lead to early intervention, and early interventions have proven to lower the risk of death of lung cancer by 20%. The lung cancer screening program is only recommended for people who are considered high risk for developing lung cancer, so we can't just screen everybody.
Okay, so what would make someone high risk for lung cancer?
So, of course, smoking puts you at high risk. We look at patients that have a long smoking history, such as someone who has smoked for, on average 1 pack a day over 30 years. It doesn't have to be a consistent 1 pack a day. It could be, a half a pack a day here or there, or 2 packs a day for 15 years. But the insurance companies actually set the criteria for a patient. They have to be within a certain age range. You have to be between 55 and 77, and you have to be a current smoker, or if you have quit, it has to be within the last 15 years. And that's because the last 15 years has given your body time to recover and heal from some of that smoking damage.
Are there any health problems that would put you outside of the criteria for this program?
So lung cancer screening is intended to catch cancer early and send patients for surgical intervention to cure the cancer. So the patients have to be eligible for surgery intervention. So anything that would prevent a patient from having surgery, such as previous or prior health issues, it could really be anything that would prevent them from having surgery.
What can you tell me about the low-dose CT screening itself?
So the patients will come to the hospital for a shared decision-making visit. They'll meet with our nurse practitioner and have an open conversation with her 5 to 10 minutes. And they talk about the risk and benefits of the CT scan. They talk about what they could do to prevent lung cancer, what they could do to help improve their health. The patients go down for a CT scan, and it is a regular CT scanner. It's the donut machine. It's not the tube that people fear with claustrophobia, but they will just quickly screen your chest. It's a probably 10 minutes exam. Patients don't have to get undressed. The patients don't have to drink contrast. They don't have to start an IV for anything. It's just a quick scan of the chest, and then the patients head out the door.
Okay. Are there risks associated with this CT?
The biggest risk, as with any screening, any sort of testing, is the risk of getting a false negative or a false positive. You always have a risk for incidental findings, because a patient's going to have that long smoking history. We know that there's damage to other organs in their body, such as heart disease. We might find, that they have lung disease, so they might find some other incidental findings. There is a risk of radiation exposure from the CT scan itself, but it's very minimal, and that's why they call it a low-dose CT. So patients, if they do find incidental findings, then the risk of that is just that they're going to have follow-up with other physicians that they weren't planning on having.
The benefits seem to outweigh the risks for this procedure. What do our patients get from this low-dose CT screening?
So the biggest thing that they get out of low-dose lung cancer screening is if there is something in their chest, they can catch it early, and that's when it's most easiest to treat. Screenings have been proven to reduce the risk of dying from lung cancer because we do find it early. These CTs it's very fast scan, like I said, less than 10 minutes. They're in and out the door. It's non-invasive. And we want to begin, or we want to find cancer early so that we can intervene early and save that patient's life. If for some reason we were to find something a little bit more advanced, then patients could begin their treatment sooner, rather than waiting until they start developing any symptoms.
Okay. In my time as a nurse, I have noticed that among patients, there's some confusion between what an X-ray is and a CT is. Can you explain the difference?
So an X-ray is just a flat film. It's, maybe one from the front and one from the side. But an X-ray can only pick up larger masses within the chest, whether they're larger nodules or whatever abnormalities may be there. A CT scan typically does multiple cross-section pictures that will help see a little bit more in detail in the patient's anatomy. And if we're looking at a CT of the chest, they're looking specifically at the organs within that region. So we're looking at, of course, we're focusing on your lungs. So they look at the airway. They look at all the aspects of your lungs to make sure there's nothing there concerning for cancer.
Okay. I imagine that the most common questions are about cost and how patients receive the results. How does that work?
So when the patients get scanned, it typically takes about 24 hours for those results to be available. They will immediately be available to the patient in their MyChart account. I also print a copy and mail it out to the patient as well as their primary care physician. And if there's anything incidental on the scan that I need to alert the patient of, I will call them over the phone and just let them know, that we did find something concerning, and that way they know they need to follow up with their primary care a little bit sooner.
What role do the insurance companies play in determining if patients get this scan and what their cost will be?
So the insurance companies actually drive the criteria for the screening. So the patients have to meet those criteria that I mentioned earlier. And if they do meet the criteria, then the insurance companies view this as a screening exam. And most, I will say, maybe not all, but most insurance companies do approve this as a 100% covered screening exam. Some patient plans with their insurance companies they do require the patients to have a copay or some sort of out-of-pocket cost. If the patients cannot afford that, we do have programs available here at Cone that is money that we can help patients pay for those costs. We have different grants and money that we can use for that.
As we know, smoking leads to a high percentage of lung cancer. What can we do to encourage folks within this community to stop smoking?
So Morgan, it is the personal choice of whether or not they choose to quit. Us as healthcare professionals should encourage them to quit so that way they can improve their health. But it's not going to be something that we force them to do. We want to, for the patients that meet criteria, we want to continue screening them yearly, regardless of their smoking status or their desire to quit or ability to quit. We're going to continue screening them every year because we want to, if lung cancer is found, we want to find it early and we want to intervene early. If patients are interested in stopping their smoking habits, when they come for their shared decision-making visit that first time, we can give them the education material that they need. We can offer them our Quit Smart program that's offered here at Cone. It is free to the patients. We just have to help them get enrolled, and then they would attend the classes virtually right now. And like I said, it doesn't cost the patients anything to do that, but we will continue screening them, like I said, regardless of their smoking habits. If patients, like I said, if they wish to quit, then we can give them that education. But if not, we're just going to continue to march forward.
Overall, this sounds like a great program. How can our viewers access this program?
So this program is a self-referral program. They do not have to have a physician order or a physician recommendation to come. If they are within that 55 to 77-year-old age range and they feel like they have the smoking history, they can give us a call at 336-951-4678. And all they have to tell us is their name, date of birth, and we will get them on the schedule to be screened. And they can also send us an email if they would like, or they can talk with their primary care physician if they feel like they want more information, and then their primary care physician can refer them, but that's not required.
Diane, can you tell us about any patient results that you've seen through this program and how it's impacted their lives?
We've been doing this program here at Annie Penn Cancer Center for 1 year. And to date, we have screened 93 patients. Of those 93, 2 patients were found to have lung cancer. They were found early enough that we could send the patients for curative surgery, and the patients did not have to have chemotherapy. So those 2 patients that we saved, that's the benefits of this program. We're here to early detect, early intervene, and save lives. And so we've done that for those 2 patients.
Thank you all for being here with us today, and thank you for letting us show you a bit of our world here at Penn Health Cancer Center at Annie Penn Hospital.
Visit our website at www.conehealth.com/Annie Penn Hospital for more information on the hospital and the services that we provide. And thank you all again for joining us for us to show you how our cancer center can be right here with you and with the greater Rockingham community.